tiny fraction of doctors flirt with their patients, and I always knew it was serious, but I didn't know how real it was until I experienced it. I'll share my story, and at the end, 5 powerful tips for what you can do if you ever end up in this situation. And these are the same tips I share with my patients who are coming to heal from sometimes traumatic experiences in medical settings like this. The American Medical Association very clearly states that the patient-physician relationship needs to be terminated before any type of romantic or sexual relationship. And even relationships with former patients may be unethical. In a recent Canadian study, about 0.1% of all physicians were ever disciplined, but of that small percentage, about 20% of the cases involved sexual misconduct. Psychiatry, family medicine, and OB-GYN were the specialties most likely to be involved. That makes sense because these doctors often have the longest and deepest or more intimate relationships with their patients. That's especially the case in psychiatry, where there are many vulnerable and sensitive topics being discussed. My experience actually wasn't as a patient, but when I was a medical student, and when a supervising physician began commenting on my gym workouts and outright flirting with me. This quickly taught me 3 things. The first was that it feels absolutely terrible. The second was how difficult it was to speak up because there was a power differential between me as the lowly medical student and the supervising physician who was in charge and had control over where I could end up for residency. And number 3 was how afraid I became at the thought of upsetting this doctor by disengaging with them. I had 2 other scenarios with male nurses that also made me feel very uncomfortable. They also involved commenting on the gym and how I looked, and it wasn't because of the scrubs I was wearing, because they were extra large clown-sized scrubs. I remember that very well. This is similar for patients who often get commented on for their weight or recent weight loss, their clothes, their shoes, or in the case of women, their breast sizes even. Like patients who have had this happen to them, I don't care to go into the gossipy details because it's just irritating and frustrating, honestly. And if this is resonating with you, please share my story and your story with others so that others know that they're not alone and that they can better advocate for themselves. My examples are also similar to other patients who are trying to get health care, sometimes when there isn't another doctor or specialist in the area. There's actually a case of a family medicine doctor from the UK, Dr. Simon Holmes, who married not 1, but 2 of his patients. Not at the same time. The first marriage lasted about 13 years, and both of the patients were seeking help from Dr. Holmes for their psychological health, for depression, and for therapy around relationship issues. There were presumably other family medicine doctors around in the UK, but both of these patients demonstrate that when we're vulnerable, we need to be extra cautious about having that vulnerability exploited. I've had many patients who have struggled with medical PTSD coming from romantic misconduct or otherwise. And I've taken these lessons from my history and from the literature to help protect them on their healing journeys. And here are 5 powerful tips and 1 bonus for what to do if a doctor is flirting with you in that vulnerable situation. Number 1, ask for a chaperone. Whether a nurse, a medical assistant, or even a medical student, having a third person in the room can absolutely squash flirtatious fronts. Number 2, wear a mask, especially if you're having a procedure done in the office, especially if it's near your face. Wearing a mask or asking the doctor to wear a mask with you can also tone things down pretty fast. Number 3, bring a pen and a pad of paper and say out loud what you're writing down on that paper. Because in many states, it's illegal to voice record conversations without explicit permission. But if you're saying out loud and writing down what someone else is saying, that someone else is going to be a heck of a lot more careful about what comes out of their mouth, especially romantic comments. Number 4, if you start to feel uncomfortable based off of what someone's telling you, you can either verbally acknowledge it Or if that's uncomfortable or doesn't feel right to you in the setting, you can always say something like, "My elderly father is waiting for me. Can we please be efficient with our time?" Of course, you can replace elderly father with mother, brother, friend, whatever, but it can pretty clearly redirect the conversation without antagonizing what the other person is saying. Number 5. If you anticipate having to show part of your body to your doctor, instead of taking everything off and wearing a gown, you can plan ahead of time and wear clothes that let you easily expose the body part that has to be shown to your doctor without having to take everything off. For example, in my clinic, if a patient's coming for a stellate ganglion block, I don't have them take off their whole shirt. I ask them to wear a tank top or something with a low cut collar so that I can expose their shoulder and do my procedure without them having to take their whole top off. And as a number 6 bonus, while I appreciate hugs in certain contexts, sometimes if we're feeling vulnerable, a hug might feel too intimate. If you anticipate a hug coming your way from a doctor or someone else, but you're not feeling ready for it, you can pivot and go for the professional handshake or elbow bump. If you've ever been mistreated before in this context or know someone who has been, please share these tips and advocate for yourself and them. And let me know below in the comments what has worked for you. And also remember that there's a flip side to this story of when patients flirt with doctors. I've experienced that as well. And if you're interested about hearing those stories, let me know as well in the comments. And remember, you have more power over your health than you've probably ever been told.